Okay, I'm going to be doing a subcutaneous heparin injection. So the first thing I'm going to do is check my chart, make sure I have the right patient, the right medication, the right time, and this actually says to give 0.2 milliliter of heparin now. So I'm going to check my MAR and make sure that the order matches, that the patient's name matches, which it does. So I'm going to go ahead and wash my hands, and then I'm going to get my medication. And these little vials, if they have some in the top, you can just kind of rotate it quickly and it should come out of there. There we go. I'm going to get a gauze here and I'm going to break this open. I don't want to break it away from myself. So put a little pressure there and break that off. Put that in my sharps container. And then I have a filter needle here on my 1 milliliter syringe. Take this off here, and I'm going to stick this into my vial without touching the sides and draw up the 2 milliliters that I need. And then once I get that, I'm going to turn it upside down and draw up 2 more milliliters, 0.2 milliliter of air. Once I get that in there, I'm going to recap my needle, and I'm going to change my filter needle here, put that in my sharps, and I'm going to put on a regular needle here. So once I get my needle on there, I'm going to go to my patient. I'm going to identify them. I'm going to make sure I have the correct name, birth date with 2 identifiers. I'm going to check the medication again before I give it, make sure it's the correct dose. I'm going to make sure it's the right time, which we need to give it now, so we're going to go ahead and wash our hands. I'm going to put on my gloves. For this site of heparin, we want to do it below the belly, kind of in the person's kind of fatter midsection there. If they don't have a lot of fat, then we'll need to make sure that we pinch it up so that we don't get it in anything. So we're going to choose our site, staying away from the belly button. We're going to clean it with alcohol. Once we clean it, we want to let it dry for a minute. And when the alcohol dries, we're going to take our needle off here, and I'm going to pinch up a little bit here on both sides. We're going to go at a 90-degree angle. Insert this into the patient. Make sure to push the bubble in there and pull it out. Recap our needle. Dispose of that in the sharps container. We have a little piece of gauze here. We can kind of hold that if it's bleeding. We're going to make sure that the patient understands why we're giving the injection, what we gave it for, any other information they have questions about. We'll discard all our stuff in the sharps. I'm going to wash our hands, and then I'm going to go out of the patient's room, and I'm going to document how much was given, the site that was given, the time it was given, and make sure to date it and anything, any education we did or anything like that. I want to make sure to document all of that. And that's it.